Good afternoon, Dr. Lou.
Good afternoon, everyone.
Thank you for joining us. I'm Keith. I'm with the Cure Starts Now, but also a founder of the DIPG DMG Collaborative. And we're excited to be able to talk a little bit about your grant on targeting DIPG through therapeutic dietary intervention. Um, Before we go ahead and get started, though, and going through some of the elements of this grant, I am pleased to let you know that on behalf of all of the 28 members of the DIPG DMG Collaborative, we've decided to go ahead and award you funding for $100,000 US dollars
Thank you
for
very
your
much.
grant to Columbia University.
Wow, what a surprise! I thought it was more like an interview, but thank you for the check.
Yeah, well,
Um, Thank you for your support. As you all know, pediatric cancer needs more support, especially during this difficult time. This is a very high risk project, so I'm very happy that we'll be able to get the funding to do some of the experiment that we're really excited about.
well, fantastic. And we're excited to learn a little bit more about the grant as well. But before we go ahead and get into some of those questions, I want to introduce Christy, who wants to also offer her congratulations.
Hello, Dr. Lou. My name is Christy Jennings, and I'm president and founder of Whitley's Wishes. My daughter Whitley, unfortunately, did lose her life to DIPG in 2015 at the age of 13. And during her battle, we did experiment with changes to her diet. So this research is something I'm very excited about. And I just wanted to take this opportunity to tell you thank you so much for your efforts and congratulations and good luck to you. And now I'll pass it over to Melissa.
Hi, I'm Melissa Fleming. I'm the director of the Austin, Texas Team Brock chapter of the Cure Starts Now. So my son Brock battled DIPG in 2016. So I just want to congratulate you. Thank you so much for dedicating your career towards this. Us as families raise money, and we'll keep doing it as long as you keep finding research and hopefully finding the cure. So thank you. And I'll now hand it over to Martin.
Hello, I'm Martin. I'm from both the IPG Collaborative and also from the international point of view. I'm a representative of National Foundation NINA from Czech Republic, from Europe. First of all, we also congratulate you to this fantastic support, and we hope that your research is going to bring some important information for the patients and their families how to attack this terrible disease. And let me to move to Jackie.
Hi, Dr. Lou. Thanks for being here today. I'm Jackie Criswell. I'm with The Cure Starts Now. More importantly, I hold the title to being a very proud aunt to Elena, a DIPG angel. When she was battling, I do remember Keith and Brooke really digging into her diet and changing a lot of what she did and seeing if it would have an effect. So this research is just even doubly important. I see a lot of families ask a lot of questions about that, so this is appreciated. So congratulations. Look forward to seeing what comes of your research for sure. I would also like to introduce Rachel. I think she also has a few things to say.
Hello, Dr. Lou. My name is Rachel, and I'm the Research Support Coordinator at the Cure Starts Now. Congratulations on your award. We are excited for you and excited to see what comes of the research. So I do have one follow-up question. In a field where most treatments focus on drugs and radiation, why might targeting nutrients offer a new research advantage for DIPG?
Yeah, so thank you all for supporting this effort. We all know DIPG is a very devastating disease, and I have been working for I think 12 years now, ever since this a mutation that in a gene of histone H3 that we study a lot, been discovering in this childhood tumor, and I have been dedicating my career trying to understand why this mutation causes disease, leading to where we are now. So now getting back to Rachel's question, why we think at least we'll supplement with some of the other efforts that people are discovering for a cure for this disease. First of all, is that tumors is being just across the broad cancer. People have been discovered that in addition to have genetic mutations, cancer cells do change the way they uptake and metabolize nutrients. So this whole idea of targeting the metabolism cancer has been good evidence in other cancer types here. We're trying to take that concept and to see whether in this particular disease, whether there's some certain vulnerabilities by tumor cell that we can take advantage of from a metabolic angle. From a more practical standpoint of view, a lot of those diets, including the one we're trying to test here, has been used in the clinic already. So this is the one thing we're very excited about our proposal is that once we identify the DIPG cells have this unique dependency on three amino acids. We call them branch chain amino acids, leucine, isoleucine, valine. So those are in our diets. And what we find that for the mechanism, we still don't quite understand. This is part of the proposal. DIPG cells, compared to other normal tissues, really rely on the uptake of those three amino acids. That's interesting, but more importantly, that there is a clinically approved regimen that limits the intake of those three amino acids. That has been applied to pediatric patients that are born with genetic disorders where they have problems of uptaking and then metabolize those nutrients. So those kids are born with what they call is the branch chain amino acid aciduria. So they actually have too much of this amino acid in their blood, which is harmful. But clinicians have been actually reducing those diets and successfully treating those patients, which also shows that just by limiting some of the extent, it's safe. I mean, safety is the one thing we really want to take care. But this is a regimen where it has been shown clinically to be safe in pediatric patients. Now we're just trying to say if our preclinical model works, maybe this will be something that a DIPG patient can try in addition to some of the treatment they're undergoing. There are a lot of unknowns. Like I said, this is a high-risk project. No one have really thought about from this angle, but we really hope that some of the experiment we're trying to do there will at least lay the foundation for a clinical trial that allow pediatrician to an oncologist to try this kind of dietary regimen on DIPG patients.
Great, thank you for explaining that and explaining the implication that it might have for kids with pediatric brain tumors. We appreciate it.
Thank you.